Imagine this. You have been attending class for the past 3 months and you notice a classmate attending every day as usual, but obviously he is not looking too well. He is constantly coughing and covering up as if he is cold. You personally thought the room felt kind of stuffy and hot. You notice his cough seems to be worsening over time. This classmate is practicing good hygiene by covering his cough and sitting away from the other students in the back corner of the classroom. You spend an average of 1.5 hours in class, 3 times a week. One day you get a call from your local public health office with notification. You have been listed as a contact to a confirmed pulmonary TB case in your area. You need evaluation, screening, and testing, they tell you. Has it ever crossed your mind, living in the US, you can actually contract a fatal disease through the air? According to Centers for Disease Control and Prevention, CDC, tuberculosis is one of the world's deadliest diseases. 1/4 of the world's population is infected with TB. This occurrence may be rare but possible in a classroom setting. Being a TB nurse, I come face to face with this curable, but in some cases deadly disease. I work in the community to identify, treat, and prevent the spread of tuberculosis. Sitting in a classroom within close quarters, poor ventilation, long exposure can be a setting for transmission. Today I'm going to talk to you about 2 classifications of tuberculosis, its transmission, and when you should consider TB testing. Latent TB infection, also known as LTBI, is a process in which the body has been exposed to the TB bacterium. You breathe it in and it settles in your lungs. At this point, if the body is healthy, the bacteria is met with the body's defenses. The body is not allowing the bacteria to grow and multiply. At this point, the process is considered infection. You do not feel sick, have no signs and symptoms, and you cannot spread this infection to another person. According to CDC, overall, about 5 to 10% of infected persons who do not receive treatment for latent TB infection will develop TB disease at some time in their lives. Now let's talk about TB disease. TB disease is the process in which the bug that entered your body is now growing and multiplying. The body's defenses are not able to contain it. The dormant or new infection has become active disease in the body and can start causing illness. At some point, you will start showing signs and symptoms and can transmit the disease to others through the shared airspace that we breathe. In most cases, it is your loved ones with whom you live with. Now that we understand the 2 TB classifications, let's look at factors contributing to its transmission. TB is transmitted through the expelled droplets in the air when a person with active TB disease is coughing, talking, sneezing, or singing. We must consider how often and how long a person was exposed to this infectious person. Was it 15 minutes, a couple of hours, 8 hours during a long road trip, or do you live with this person? We must also consider where the encounter took place. Was it inside or outside? If inside a building or apartment, how well ventilated was the space, or did it feel muggy and hot? Next, and very important, is considering the exposed person's state of health. Do they have an altered immune system? Typically, the infectious period goes back at least 3 months from the initial diagnosis or when the person started having signs and symptoms. Tuberculosis is a slow-growing bacteria. By the time a person develops signs and symptoms, his infectious period may have already started. According to CDC, TB is not spread by shaking someone's hand, sharing food or drink, touching bed linens or toilet seats, sharing toothbrushes, or kissing. Now that we have discussed ways in which TB can and cannot be transmitted, let's look at who should get tested. TB testing is recommended for all persons confirmed exposure or presenting with classic signs and symptoms of TB, such as persistent cough for more than 2 to 3 weeks, chest pain, coughing up blood, weight loss, appetite loss, fevers, chills, night sweats. TB testing is also highly recommended for persons with certain medical issues because this places them at a higher risk for progressing to active TB disease from the initial infection. Some of these medical conditions are persons with HIV, an organ transplant recipient, a diabetic, a person with renal disease, or persons taking certain medication or treatments to suppress the immune system. TB testing can be performed by two methods, a skin test or a blood test. A positive TB test, whether it is by skin or blood, will only indicate infection. It cannot distinguish between infection versus disease. Today I briefly spoke to you about tuberculosis. And I am hoping you now are able to distinguish between TB infection versus TB disease, the transmission factors, and recognize who should be getting tested. Tuberculosis is not a death sentence. TB is curable if contracted. We are a long way from eradicating TB, but we can start the process by identifying and treating TB infection.